Will the TMJ issues go away on their own? Well, I think the answer is pretty obvious. You wish they did, and the answer is no, they don't. They didn't come for no reason, for them to go away for no reason. Your TM joint, temporomandibular joint, is a ball and socket joint, and it responds to a lot of different things as a result of imbalance in those structures. Your temporomandibular joint becomes very much influenced and impacted. So believe it or not, the muscles on the two sides of your throat, there is a muscle that is connected to your shoulder blade. Yes, there is one that connects this to your shoulder blade, and the position and tension of those muscles impact your temporomandibular joint. There are conditions like hypermobility, which is a connective tissue disorder, where what keeps the ball and socket in place, which is your connective tissue, is too lax. It lacks a specific protein, or it's an altered version of a specific protein that impacts the stability within all of your joints, with the TM joint being quite influenced by it. So when that connective tissue is not keeping the joint or stabilizing the joint, then I'm trying to simplify what's happening with the TM joint, but there is this sac that gets left behind as the movement happens, so it gets compressed, and that sac contains blood vessels and nerves, and that causes pain. And that's a lot of times what's happening with our bendy population. Things like tongue tie impact the position of your mandible over your maxilla, over your skull. And what happens is the position of your tongue, if there is that tie that pulls it down, it disallows the tongue to actually touch the surface of the roof of your mouth, and that changes the positioning of the ball and socket, and that comes with a series of imbalance and tension in that area. Bottom line here is, and these are just a few examples, your neck position, the position of your head over your neck, the position of your neck over the rest of your body creates an imbalance on the tension of the musculature in your neck, in the front and in the back, and now that influences how well this ball and socket moves. So these are just examples of what can go wrong, and for you to think that a mouth guard is going to solve the problem, you're mistaken. Remember, those mouth guards prescribed by your dentist, at least high majority of them, if not all, are to protect your teeth, because chances are you're grinding as you're sleeping at night. You need to chase the whys. Why am I having this problem? Not that, okay, I'm grinding my teeth and that's why I'm having TMJ. Well, why am I grinding my teeth? So when we use external apparatus to fix something, that means that we are lacking that environment that innately put us at an advantageous level. So there is a lot of chasing the whys that I'm trying to encourage you to do, because until then, your problem may be solved, but that's temporary. And so if you're using the time, you're buying the time to have temporary relief, to have it projected for much longer time, I strongly suggest you use that time of release or less pain to find out what else is happening. Putting off the proper solution is never the right answer. I'm Dr. Shakib from Irvine Spinal Wellness Center, right here in Irvine, Orange County. We see patients with hypermobility. We see patients with postural instability, dysfunctional movement patterns, and the focus of us is to connect the dots, and most importantly, allow you to make that connection by providing you the information and the knowledge necessary to problem solve. If you like what you saw, make sure you subscribe to the channel and use one of the methods of connection in the description box to contact our office. Until next time, take care.